I'm Denise.
I'm Katie.
I've been friends with Katie for over 20 years.
I cannot believe it's been 20 years.
This is
88 Chat,
where we talk about a really random program.
We are back. Hi.
Hello. Okay, let's talk about something that is kind of a serious topic. Between healthcare workers and getting the vaccine. We all know there's some people in the healthcare world that are not wanting to get that vaccine. Mm-hmm. Me, I can't afford to because I am high risk. So I got the vaccine. Did you get the vaccine, Katie?
Yes, as soon as I was eligible, I jumped right on it. I documented it with photographic proof. I'm going to frame it and show it to my grandkids someday.
So that's the thing. So like some healthcare was like, the reason why I got the vaccine is because I was told I would get fired. Like you work with sick people.
Right. I have a personal story about this, actually. When my mom was on hospice, it was very new that the vaccine was out. And it was, it's still a hot topic, but it was even more of one because it was brand new. And we had a nurse that was coming maybe once a week or less. My dad braved the topic of asking her, "Oh, are you getting the vaccine?" And the nurse said no because she had pre-existing conditions of some kind, like asthma, which I know you have comments about that. And so she wasn't going to get it. And I really had to bite my tongue. Thankfully, I had a mask on, so she couldn't see the expression on my face. Because, my mom was a nurse for 35 years, and I saw what real quality healthcare and truly caring for others looks like. Thankfully, she was not aware enough at that point to get outraged by the situation, but I know that she would have been outraged by that kind of situation. And as someone who spent a long time learning from someone in healthcare, I'm outraged by it. To go into other people's homes and be caring for them and thinking about their health first, and then simultaneously be potentially endangering them and also endanger their family members as well. And I would horribly misquote if I tried to quote it, but part of becoming a healthcare worker is to take an oath to do no harm to the people that you're helping, basically. And in a pandemic that we know is extremely deadly, to not get vaccinated is not doing no harm. Plain and simple. If you don't want to listen to the science that you have given your life to, then what are you doing? And I know that's something that a lot of people would just be really angry to hear me say.
Yeah, just because I know a lot of people are probably gonna be pissed off a little bit upon this topic. Yeah. We aren't saying that healthcare workers aren't doing a good job and that they're doing hard work. We're just saying that sometimes people need to take in account, like, your profession is to take care of sick people, not to try to kill them with a disease that's easily spreadable.
Right.
The thing is, like, a lot of people like, it's too fast and we don't know what's in it. We know what's in it because it's just, when we read it, it's a little bit complicated to us because we don't know those words, and half the time we have to look them up.
Right.
And then
that's absolutely true. Is everyone, in any case, any vaccine or medication, ask for the information. You have a right to ask for the paperwork and ask questions. Please do that always.
That's why when you take the vaccine, when you get the shot, they tell you to wait 15 minutes because they don't know if you're going to have an allergic reaction. The 15 minutes is for them to determine whether or not an allergic reaction will occur. But they said, like, research it, look through it, and there is information. It's just going to be really heavily scientific ingredients. So you might have to look up and say, what the hell is this?
Yeah.
But also, some people are not getting because too fast. FDA approved too fast. FDA they are really rigorous when it comes to approving medication. There's a reason why they had to put a pause on Johnson because of blood clots. Because I'm pretty sure it didn't come up.
And I think that's a good point to point it out that clearly, if problems come up, they're doing something about it. So it's not getting totally ignored. It's
So I watched a doctor series a little bit upon the vaccine. It's not going as quick. It's just what they're doing is combining a couple of the steps and making it shorter. Because there's a long process how people do process. They're like, okay, we're combining steps 2 and 3 together, so then we can do it at the exact same time and see if we get there a little bit quicker. The only thing missing from the scientific studies are longitudinal studies, but those things take a really long time, and that's just not what we have. Time is not on our side with this disease. So we have to do what we need to, and the vaccine is helpful. I mean, one vaccine may be helpful than the other when it comes to different variants. So like for nurses, like I'm pretty sure they know this because for nurses they have to study and go to school and have a license. They take, I believe, it's almost the same oath as they do doctors. So nurses, healthcare workers, they have to be prepared for a lot of things, and being scared of a vaccine shouldn't be one of them. They should be able to say, okay, if they have a medical condition or if a religion that says they can't do it, okay, that's fine. But no, that I'm gonna put you on arm's length until this died down. I mean, there's a reason like me and you are doing this by video,
right.
by Zoom, instead of in person, because I know you have a child. I don't have a child, except for I am careful for you because I think your son's awesome, and hopefully one day, right, that I will have a kid just like you. My top priority is making sure you guys are safe versus me.
Right. And that's a really important thing, that first of all, I appreciate you. Um, but that a lot of people are doing that, are whether or not they have young family members, or if they live alone, or if they have health conditions or not. There are lots of people out there who are doing it for others, and that's what we should be doing. Is that's
Yeah,
what the concept of herd immunity kind of is about, is thinking about everyone. So thank you for doing that. And I'm sure you've had the situation of it's come to a point in our culture, I don't know about in other countries, but in ours, where it's creating rifts in relationships because it's so polarizing that I know in our family, there's people that we no longer have contact with because I'm not going to endanger the life of my child that I've, devoted my life to caring for because of a relationship. If the relationships are a two-way street, and if you're going to endanger me, then clearly I'm not important enough to maintain that relationship. And that's not a cool way that we have to live now, that every relationship has to be weighed on that scale of how much that, are they going to value my life enough to be a friend or a family member or whatever. And that's really what it's come down to for a lot of people. And that's really sad.
For me, my health has been horrible for a very long time now. Sometimes I meet nurses that are really helpful. They know what they're doing, and they're really careful and they're very cheerful. As much as they're scared, which you have to list the pros and cons here. Just like everything else in this world, you have to list pros and cons. And unfortunately, the stab in the arm has more pros than cons. It's just something I think a lot of us still needs to think about. And yeah, as much as we want to argue with those people, there's no point. Just because everybody is telling people, pushing people to get the vaccine, a lot of them won't do it unless something changes to affect them personally.
Yeah.
But I kind of like thinking, will we ever reach herd immunity? Probably not. Our countries are based, everybody keep on talking about freedom. Yes, our freedom is is very nice, but at the exact same time, it's what's causing us to not get to that herd immunity.
Right. People are saying, well, it's just like the flu.
It is not the same thing as the flu. I really don't like people saying that.
But understanding history, the flu was also a pandemic, and it was also something people had to get vaccinated for and wear masks for. And it was through doing the proper steps that it became what it is for us now, that it's not as much of a big deal. So, yeah, maybe someday we'll be able to say that COVID is more like a flu, but right now it's more like the flu was back when it was a pandemic. It's still a pandemic.
Yeah. So that's why, like, I don't like it when, like, it's just a flu. It's like, no, it's not. The point of it, of the shot, is to prevent you from going to hospital and dying. It doesn't mean it's not a shield for all that you won't get it. They keep on pushing that part. It's like, it's not. There is a possibility of you getting it, except for the symptoms will be either closer to asymptomatic, where there is no symptoms, versus mild symptom, more closely where you kind of might mistake it for the flu. I thank healthcare workers for their service, for these long hours that's happening, and the beds filling up with sick people. But at the exact same time, like, I know they're busy. They should at least take a time to maybe just get a stab in the arm. It's completely worth it. It maybe help you take maybe a day off to rest and heal your body from all that hard work that you've been doing. A lot of healthcare workers and nurses are working really hard around the clock. The hours are wonky because there's so many people who are sick.
That was a headline in one of the states that has a really bad surge. The article was talking about if your child is in need of any kind of emergency, their hospitals are out of beds because there's so many children now getting COVID that there's no beds left. And so all those workers are obviously totally maxed out, because it's not even whether or not there's anyone available to help you, but there's no bed to put you in because everybody else is taking them up. And it's not a great headline to see, oh, well, your kid's not going to get to go to the emergency room for that broken arm unless somebody else's kid dies. Like, do you want that to be your kid that dies? That I don't.
I think we need to clarify, because a lot of people say kids. The kids we're talking about is the ones that are in elementary school through the very first year of sixth grade, preschool age, to like 12 is the most vulnerable group, because they aren't getting vaccinated because we don't have a vaccine for them yet. So that's the vulnerable group that we're looking at. We're taking a look at. From 12 and over can get the vaccine. Moms who are still breastfeeding their kids are giving who have gotten the shot, it's giving their antibodies to the kid. So that's how they're protected, is through the mother's milk. I'm hoping that more people get vaccinated, because more people who are unvaccinated are dying. And we keep on seeing story after story. Like, I thought it was a hoax, I thought it was just a flu. Then all of a sudden, a couple days later, oh, they're dead. Like, yeah. No one. The other hard thing is that they're dying alone.
Yeah.
They're surrounded by doctors, and that's it. And maybe possibly one loved one, but that's it.
Yeah, that's not what anybody would wish for themselves.
I wouldn't wish that on anybody. So either we can pick this topic up a little bit at a different time, just because it's such an in-depth topic to go through.
I've got a really bad disease. It's got me begging on my hands and knees. So take me to emergency, 'cause something seems to be missing. Somebody take this pain away. It's like an ulcer beating in my brain. So send me to the pharmacy, so I can lose my memory.
No. Bark. No. Bark.